Hello. Today we're going to be talking about assessing and providing interventions for patients in mental health nursing situations. Now, going back to your fundamentals of nursing, which you've no doubt taken before you took this mental health course, you learned about ADPI. What is ADPI? You have your assessment, your diagnosis, your planning, your interventions, and your evaluation of nursing care. Now, why is that important? Now, if you really want to do well in nursing school, on the NCLEX, and even in your nursing practice, it's extremely important that you understand the nursing process and how it relates to the term ADPI. Now, one of the most important things that you need to understand when you're doing nursing school examinations or the NCLEX, and even in practice, is that you always think or assess before you act. The assessment in ADPI and nursing interventions, usually comes before the I. Rarely in nursing do we intervene before we act. Rarely do we intervene before we assess. We generally act after we assess. Why? Well, let me give you an example. When you pull up to a four-way stop, right? You're a four-way stop sign, you're in a car, on a bicycle, or even walking for that matter. Do you just proceed directly out into the intersection? Probably not. Well, maybe. There might be some of you out there that do, and I've been in my fair share of car accidents myself. But the thing is that you generally look both ways before crossing the street. Why? Because you want to make sure that it's safe. You want to know what's going on, right? Same way as you're driving down the road. You kind of look where the traffic's going in order for you to, weave in and out or know that your stop or something's coming up. The same thing applies in nursing. We want to make sure that we assess before we act. Whether that is when we're doing CPR on a patient, do we generally shock them before checking for a pulse? Do we generally do chest compressions before checking for a pulse? No, of course we don't. We always want to assess what's going on. This is no different in the mental health setting. We as nurses need to make sure that we assess what's going on with our patients before we act. Granted, quick thinking is often important. We must assess before we act. It just all goes back to the nursing process. For example, if you had a patient who was flinging food in the hospital cafeteria, they were just, using their fork and flinging their mashed potatoes across at somebody else, would you automatically grab the fork out of their hand? Well, you'd probably get in front of them to stop them from doing it, but you might want to ask them really quick and look at them, assess what's going on, and say, hey, why are you doing that? Right? And before you would tell them what? We need to stop. Unless, of course, the patient is hurting someone else or hurting themselves, before you intervene. My name is Nick the Nurse. Thank you for watching this video, and we'll see you next time.